Hello, welcome everybody. Welcome to this live stream on how to read a research paper and critical appraisal. So it's almost 9 a.m. Eastern time. I'm just going to wait for 30 seconds and then we'll go right in. Okay, welcome everybody. It is 9 a.m. sharp. Today we will be doing a very special live stream on how to read a research paper. I've been getting a lot of requests on a deep dive because one of my previous video we were talking about reading research papers fast, but how do we actually go through? How do we appraise a research paper? How do we really understand it in order to know what's going on? How I'm going to present today is I will briefly show what critical appraisal means, just a brief slide, and then we will walk through a whole research paper together. And my goal is I'm going to walk it through. I'm going to give my commentary so that we can pull out some of the nuggets that you may see when you see a research paper. The way this is going to be like is like I am sitting with you. We are going to read the paper together, me as your mentor. And that way, if you have any questions, put it in the live chat. That way I can answer you. All right, let's get started. Okay, so first, I am going to talk briefly about what critical appraisal means. So when you see critical appraisal, you look under the dictionary. It just means an examination of the value, condition, and qualities of something. In a research paper, a critical appraisal means you're looking at the value and the quality of the paper. And in property, when somebody buys a new house, they actually need to go through property appraisal, which is the same. You're looking at the house, what's the value, how many rooms, how good it is to determine the price. So I like to show this in parallel to understand why we do critical appraisal of a research paper so that we can determine the quality. And so what does it mean? So a critical appraisal looks at the way a study is conducted and examines factors such as validity, means is it sound? Is it logically sound? Is it trustworthy? What's the value? What's the relevance? And is it generalizable? So there are 5 steps to critically appraise an article. So first question is, what is the research question? And then what is the study design? Is the result valid? What are the results? And will the results help locally to people I see? Okay, we're going to start with I'm going to briefly talk about what's the study design first, and then when we go deep into the paper, we can look at the study question. So what is the study design? Usually, there are 2 main questions. What is the level of evidence? And the second question is, did the authors use the right study design to answer the question? And I want to bring up this very key point is because when we think about level of evidence, we see this triangle, right? All the different levels, and people will say randomized control trial is the best, right? Case report, case series is at lower, at the bottom of the pyramid. And I want to push this concept a little bit more, that randomized controlled trial is not the best type of study, or meta-analysis is not the best type of study because it's only half the story. The question is, can a randomized controlled trial tell you the incidence rate of a condition? Can an RCT tell you the risk factor of a condition? Can an RCT tell you if a diagnostic test is valid for a condition? So I don't want you to think about evidence as in only this pyramid, but is the different type of questions. Did the authors use the right study design to answer the study question? We need to make sure this is matched. So depending on the type of question, let's say you're asking extent of the problem, then you would probably use a cross-sectional cohort study. If you want to ask, how do you diagnose the condition? Then case control or cohort will be good. If you're asking about the treatment, yes, finally, randomized control trial will be the best. Or sometimes you cohort study if it's not ethical to do randomized control trial. Prognosis, again, RCT or cohort study. If you're testing for harm, you do a cohort study. Once we are happy with the research question and study design, the next question is the result valid? We look at the sample population. Here we go deep into the method section and we ask, is there any selection bias? Is the method of defining exposure valid and reliable? What's the statistical method? Any special method to test assumption? Once we are happy with the method, then we can look at the results. What are the results? Is it trustworthy? Is the result answering the research question? What's the interpretation of the results? Then you go deeper now. Is the result clinically important? And finally, what's the net impact? And once we're done, we can read through the discussion section and look at how the current result does it fare based on existing evidence. Then once we are happy, we find that this is a good quality, then we ask the final question, will the result help locally? So this is a 5-step of critically appraising the article. So with that background, let's go through it, the actual paper. So this is an article that I chose. I'm going to put in a comment section here. So if anybody wants to look at it live, you can download this. This is JAMA Network Open, so you can actually download it yourself. Now, let us go through the paper. So this is how I read a paper. First, I start with the title, because the title itself tells you a lot of information. Oh, sorry. I'm going to open this paper now. Okay, so we're going to start with the title. Derivation and external validation of risk index for predicting acute kidney injury requiring kidney replacement therapy after non-cardiac surgery. So here by itself, it tells you a lot of information already. One, we know that they are doing some sort of prediction. Okay, we know the goal of the study is to predict a risk index. Second thing, what is the population? Is among population with acute kidney injury requiring kidney replacement therapy, and specifically after non-cardiac surgery. So once I'm done with this title, you have a frame of mind. Okay, they are talking about this very special group after a certain period, and we are looking for prediction. So because we are predicting, it's probably, you can already know, it's probably going to be a cohort study or some sort of prospective or maybe retrospective cohort study. Once I'm done with that, then we will go through the abstract. I don't like to go too deep into the results section until I have a frame of mind of what this paper is about. And one reason I like to choose JAMA Open Network is because of this key points section. And so if somebody who likes to learn about, to write concisely and know the key points, this key points section is so concise, and it really boils everything down into the main point of the paper. So let's get started. Okay, first, the importance. Why is it important to do this study? So here they mentioned, okay, severe acute kidney injury, serious complication. And it's important because knowing the risks after non-cardiac surgery may assist with patient counseling and targeted use of measure to reduce the risk. So that's why it's important. And to solve this problem, they want to derive and validate the predictive model for acute kidney injury after major non-cardiac surgery. So here, now we have already anticipated it's going to be some sort of prognostic and cohort study. So let's see how they do it. In this prognostic study, 5 risk prediction models were derived. So they use 5 models, they derive it, and then they validated it in one cohort, adults, without pre-existing kidney failure who underwent surgery in Canada. right? Then they chose the best performing model. So first they had 5 models, and then they chose the best one, and they externally validated it. So this, you can, even at this point, you can tell this is going to be a good study, because first they use 5 different type of methods, then they derive it, and then they tested it internally, and then just to make sure it works in other population, they validated it in a different population. Now the next one is the exposure. So exposure means what? Exposure is the variable that leads to the outcome. So how did they test? They are looking at all the different risk factors, and even at, as you can imagine, what can predict acute kidney injury, demographic, the surgery, lab measures, and comorbid before surgery. Okay, so this is pretty logical, and then we can move on. What is the outcome and what's the measure? So the main outcome is acute kidney injury requiring KRT. KRT means dialysis within 14 days after surgery. Next is discrimination, was assessed using statistics and calibration. So now I'm going to pause at this point, because as we read research papers, you will start seeing new words and new definition that you don't really know. And sometimes we are tempted to just skip right through. And since this is the main method, it's better to understand what it means. So what I tend to do as a researcher, I always Google things all the time. Okay, so discrimination. I don't even go for the statistical definition. I go actually the dictionary definition. What is discriminate? To mark or perceive, distinguish, or means to differentiate. That's the main definition of discriminate, to differentiate. So they want to differentiate all the different models. So how did they assess the different models? They differentiate them using a test called statistics. Then the next one is calibration. What is calibration? Calibration means to standardize something, or to adjust precisely for a particular function, or to measure precisely. So they want to make sure it's accurate. Okay, so here you can really tell at this paper, they take things seriously. First, how do you make sure a model separates properly? And then how to make sure this modeling is accurate. And finally, the results. Here looks like a lot of words. So I want to teach you how to pull information out. And so you learn to start breaking it down. First, here's just a description. They have derived a cohort using 92,000 patients. And then the external validation, 709,000 patients. Okay, how many had the event? Okay, so now this whole section here. This whole section here is all about all the potential factors that were associated with the risk. So if you ever feel overwhelmed, if you ever feel like, oh, there's so much information, really break them down and see, okay, what is this? And here, even the first sentence, the following risk factors were consistently associated with risk of AKI requiring KRT. And then the rest are just all the results and all the factors that can predict acute kidney injury. And then finally, they talked about how the model did, discrimination, what's the sensitivity, what's the specificity, and then the conclusion. All right, now here you already screened that this is going to be a good paper. Let's dive deeper. Okay, typically when I read the introduction, after that, I don't go too much into the introduction section. The reason is I'm really convinced that this is an important topic to read for myself. But if you're not, you can take your time and read the 3 paragraphs, and I'm going to break it down for you so that you can learn how a well-written introduction is shown. This is a very well-written paper, and so I want to show you some of the background framework using X-ray vision to see how this introduction is written. So in this first paragraph here, acute kidney injury is common. Okay, basically the first 2 paragraphs, the first 2 sentences are talking about why acute kidney injury is so bad. It's a big bad problem, and then they gave more specific evidence. So they don't just say it's big. They actually gave you numbers. Accounts for 1/3 of cases. Oh, yes. Thank you. I like to try to understand results from the absolutely. Yes. Right. Usually when I'm reading, I go straight to the results, but here I'm really breaking down into how each section, what we can derive from the this paper. But if you want to do it fast, you go straight to the results section and look at the pictures. Today is really a deep dive on how I look at each section. So talking back about introduction, the first paragraph really was justifying why this is a big bad problem, and then why quantifying the risk of acute kidney injury is so important. Then in paragraph 2, they take their time to explain what has been done and why is it not good enough. So several validated prediction models are available. So they mentioned it's already available. However, in this specific, those tools exist for AKI after non-cardiac surgery. So they are now specifically talking about people with non-cardiac surgery. So here, they even justify further clinical practice guideline. They have included some recommendation. However, is not accurate. However, a lack of accurate risk stratification approaches is a barrier to further research. And therefore, paragraph 3, this is what they do to solve the problem. So you can see how this is a very well-written introduction section. They don't go too much about the background of acute kidney injury. Really, the first paragraph focus, why is this so bad? Why is it so important? Second paragraph, what has been done before? Why more research is needed? And paragraph 3, this is why we created this study to solve that problem. Now, to understand what the research question is, usually you can go straight to the last paragraph of the introduction section. Basically, they want to develop and externally validate risk prediction models and an integer-based risk index for AKI requiring kidney replacement therapy after major non-cardiac surgery. So here you can already know from the title and the third paragraph of the introduction section is what the research question is. Now let's dive deeper into the methods because we are appraising the literature. So you want to know the method is valid before understanding it, before we can even know that we can trust the results. So here it is in paragraph 1, they are talking about the ethics side. Okay, sometimes they do it later, but here they mention what sort of criteria they use, what guideline they use. Then in the derivation and validation cohort, this is really important because I read this to see what sort of database they use, whether is it big enough, what sort of definition they use. Okay, so they use a large database. Apparently, they have approaches that's described fully in other places. And then there are many definitions. In a research paper, what is really important is how they define a condition, how they define the outcome measures. Because what if they say acute kidney injury is just you can't pee? You want to make sure you define it properly so that you can compare with other papers, so that you're comparing apples and apples and not apples with oranges. So here, then they start talking about the inclusion and exclusion criteria. And then the third was what external validation cohort. So here they are talking about using a separate data set from a different state or province in Canada. And in this paragraph here, again, very important for research papers, it is how they define all the outcome measures. The main outcome is acute kidney injury requiring KRT, and they use ICD diagnosis code. Usually, this is my reviewer hat on. I don't like to use diagnosis code to define any outcome measures because it can be very variable and we are using data set. So they have justified here and said, oh, they have actually tested, they have validated an approach to show that using this diagnosis code has high sensitivity and specificity. and they put a lot of references. So that means they already know what sort of objection we have, that, okay, using diagnosis code is probably not enough. And so they want to look deeper, and they have used other methods to justify this is a valid method. And next, they went about talking all the different variables they have included. And oftentimes when we write paper, we like to choose variables or choose predictors out of our head. We can't do that. To make sure that it is a valid method, we have to justify why do we choose demographic? Why do we choose certain lab measures? We included that because they have seen all these in the literature to be important predictors. So this is another one where the authors have put an effort to justify why they choose it and how did they choose it. Okay, now next is the statistical methods. When it comes to statistical methods, usually the first paragraph is all about describing how they choose the variables. There are many assumptions when it comes to choosing statistical methods. So it is important to see, oh, the authors have tried using time, using scatter plot and restricted cubic line analysis. These are all statistical methods. You may not need to know it in detail, but know that usually statistician will do a lot of testing and assumption before deciding what sort of test to run the analysis. Now, the next step here, there's a lot of details on how they do it. And as you read research papers and find that, oh, I don't know what bootstrap means. When I see things that I don't understand, I will Google it or look for YouTube. And I'm going to put some resources and links later after the live stream to show some of the keywords that about bootstrap, on links on, there's a YouTube video here really describing what bootstrapping means. So once we're done, we are happy with the research method, then we can look at the results. And the results, once I get here, I go straight into the tables and figures because it just is much easier to understand this. So first, this is a flow chart of the cohort. The one on the left is how they derive the cohort. And then on the right is how they derive the external validation cohort. So then you want to look at the baseline characteristic. Table 1 is usually the baseline characteristic of the derivation of the cohort. And so you can see the differences. This is basically just to show you how they are different. It's not like a randomized trial where you have to see how balanced both sides are. But just to give you a sense of, okay, most people have similar in terms of surgery, abdominal surgery, 32%, 38%, they are pretty much similar. And to understand what the comorbid conditions are. Then in this table, you can see they have presented 5 different models, so 1, 2, 3, 4, 5 different models on the predictors. So remember, if you remember the beginning at the abstract, what they did was they created 5 models and wanted to choose which is the best. So first they want to use 5 models and then see which one has which variables here. Maybe the certain type of musculoskeletal, maybe certain test results. These are important predictors, and they use 5 different models. And at the end, they found that I think model 3 and 4, they were the best. So once they have created a model, they tested it out. They want to make sure that it is accurate. And so they did a calibration test. So in the circle, it's observed risk versus expected risk. So they have created all these models, and now they use, they could actually predict in the yellow, right? But to make sure that it is accurate, they compare to what has been observed and realize, you can see here it's split. It means that it is good up to a certain point, can predict up to 10 to 20%, but more than that is not as accurate. So now going back to the research question, and back to, there's one more table here. Table 3 in predictive values of Model 2. So they have decided Model 2 was the best, and they look at the sensitivity and specificity. Looks like in terms of sensitivity is fairly low, but they're very specific. So if somebody they use this AKI risk score and say, oh, this person doesn't have AKI, then you know, okay, it's very accurate, it's very specific, but you may not detect all the AKI, which in this case sometimes will be good enough because you are trying to predict somebody who can get AKI and not just treat everybody. And now after looking at the results, people like to dig straight into the discussion section. And so I like to show you some of the framework of how the authors talk about discussion. So in the first paragraph, really, they were just rehashing what has been found. We developed this, what we did. Okay, these two sentences is what we did as in this research paper, and they summarize all their main results in paragraph 1. And the remaining paragraphs were on their key findings. If you look closely, when you have a time later, each first sentence was a topic sentence, is one of their key findings. And after each key finding, the rest of the paragraph was comparing how this finding was compared to other research papers. And if it's consistent, they explain deeper. Why is it consistent and how they added more? And if it's inconsistent with other papers, they would take their time and explain why ours is better, why is it different from others. So this is how you really take your time to understand what this research paper is. And then finally, the limitations. So when it comes to limitations, there are several things you think about. One is the data itself. Is it limitations related to the type of study? So maybe it's the data. Here they talk about the limitation of data because it's from administrative data or electronic health records data. Versus they also mention some missing data. A proportion of cohort did not have preoperative albuminuria measurement, which may influence the performance of the model. So when we think about limitations, think about several ways. One is limitations inherent to the study, limitations to the data, limitations to your statistical methods. Okay, and then finally, they also talk about generalizability. So this risk model may not be generalizable for use in all locations and populations. And finally, conclusion. And so now that we have done a deep dive, I like to go back up to the key points and see how did they do it very concisely. So the main question, and see if you got it from as we read through, the main question is, can acute kidney injury requiring kidney replacement therapy after major non-cardiac surgery be accurately predicted from readily available preoperative data? So basically, they want to look at data from a huge data set and see if they can predict. Okay, what's the finding? In this prognostic study using this predicting model and with external validation, they found that a model that includes age, sex, surgery type, GFR, hemoglobin, albuminuria, history of MI or liver disease had a sensitivity of 21% and specificity of 99%, positive predictive value of 38% and negative predictive value of 99.7%. So what's the meaning of this? The findings suggest that this risk model can predict acute kidney injury requiring kidney replacement therapy after non-cardiac surgery using routine preoperative data, and it may be feasible for implementation in perioperative care. So going back to critical appraisal, right? First, what is the research question? They want to look at the risk factors. Can they predict acute kidney injury? And what is the study design? Yes, it's the right study design because it is a cohort. We are looking at prognostic. They did not use a randomized control trial. They did not use a case series to study that. They did not use a case control study. So this is a correct way. Is the result valid? It is valid where because they use large sample size, right? 70,000 patients, and then they externally validated it as well. And then the results, they did show you all the different variables that were predictive. They also showed you how they made sure that it's accurate. So they were doing calibration tests, discrimination tests, and then finally, the final question, will the results help locally? So if you are based in the US, probably it should apply to your local patients. In other countries, let's say maybe in East Asia, Southeast Asia, perhaps there could be other things that may not be relevant because not all places will use electronic health records. So you may not get all this information easily. So it may not be generalizable to places that does not use large data set or hospitals that do not use electronic health record. So this is how you kind of think through a research paper and how does it apply to yourself. So if you have any questions or any other topics you would like to ask, you can feel free to put in a comment. I'll make more videos like this if this is helpful. Okay, so if no more questions, I'll join in some other time. And I'll think about all the different type of things I could do live stream on. Have a good day. Take care. Thanks for joining me on a Sunday morning. Bye.